Thanks for the opportunity to express my opinion about this. I'm just a citizen who has developed an obsession with public health. When I hear the skin in the game argument, I'm particularly turned off because it seems absolutely fallacious to me. But I know many politicians address that, and they claim it's an extension of people exercising individual responsibility. In any case, I think imposing a premium will cause many newly covered Medicaid patients to lose their coverage, in addition to imposing punitive sanctions for missing payments and creating an administrative burden to just manage or monitor such a system. In the run-up to Medicaid expansion, I interviewed several citizens and discovered that many of the newly covered citizens, due to marginal employment situations, were unable to get coverage. One woman, a retail salesperson I interviewed, for 20 years she used the emergency room as her primary care system. I question sometimes why they call the ACA the Affordable Care Act and not the Affordable Coverage Act, because access to care has not improved. Now, this woman, because of her employment situation, will likely lose her coverage if she has to pay a premium. The ironic thing is, when she got primary care, she gave credit to the Affordable Care Act for saving her life, because she discovered she had rheumatoid arthritis, hypothyroidism, and type 2 diabetes. Without a doubt, healthcare costs in this country are absolutely out of control. Whereas healthcare inflation has abated over the last couple of years, it's poised to return with its former strength. Healthcare inequity imposes significant costs due to untimely and typically more costly treatment, productivity losses, and costs due to premature deaths. I'm persuaded we need to attack this problem by distinguishing between robust primary care and acute care. Our primary care system in this country is dysfunctional and chaotic. Our sickness model, the fix me I'm broke model, simply doesn't work and creates, again, healthcare inequities, access inequities, and does not contribute to healthcare literacy among the patient population. By promoting a wellness model built on team-based treatment, integrated mental and dental health, attention to social determinants of health, and shared responsibility, primary care becomes sustainable, affordable, and cost-effective without imposing burdens and shared costs. In addition, its focus on health as a community value, it potentially relieves the pressure on the acute care system, which arguably contributes more than its fair share to our out-of-control healthcare costs. Well, what's wrong with the acute care system, you ask? Well, for one thing, hospitals pretty much don't know what anything costs. What they know is what they get reimbursed for. And are these reimbursement rates based on quality of outcomes or quality of care? No. Back on a personal level, back in 2008, I elected to have a AAA fixed, abdominal aortic aneurysm. But I unfortunately got an infection. So that single procedure morphed into 9 procedures over 3 months with 2 life-threatening events. Now, I developed a relentless infection that 5 hours before a scheduled procedure, the pseudoaneurysm burst. A month later, I was home alone, and I blew up again. Now, I reviewed the detailed bill at the end of the summer, and it came to a whopping $460,000. I signed up for a $40,000 procedure, and my bill was over 10 times that. I as well looked at the claims and the payments. My insurance company only paid 56% of that. So what did this cost? As a retail payer, I would have been responsible for the entire thing. I felt as if somebody put me in a little red wagon and pushed it over the crest of the hill. I got no steering, I got no suspension, I got no brakes. I'm just along for the ride. Now, in summary, we don't need skin in the game. What we need is a totally revamped, robust primary care system that delivers the kind of education and support to create health literacy. And we need to expand access to primary care. We need to build better patients, and we need to give primary care providers the ability to actually do their jobs. Thank you very much.